Hello, ladies and gentlemen. Today I will be presenting on cardiovascular disease among our elderly 65 and older community in the British Virgin Islands, or the BVI. Although we are coined nature's little secret, it is no secret that cardiovascular disease is the leading cause for disease and death globally, and our little corner of the world is no exception. In this presentation, I will define cardiovascular disease, identify the population and area that is being focused on, and discuss the environmental factors that contribute and exacerbate this disease. Finally, I will highlight what our community can do and improvements to combat this issue and how we can spread this information to our community. Cardiovascular disease refers to disorders of the heart and blood vessels and encompasses conditions such as heart disease, which include coronary, cerebrovascular, peripheral artery, rheumatic, and congenital heart disease, as well as heart attack, stroke, heart failure, deep vein thrombosis, pulmonary embolism, and arrhythmia. Cardiovascular disease has a tremendous impact on all populations at the global scale. However, I will focus on the elderly 65 and over community in the British Virgin Islands, which is located on the Eastern Caribbean, and the British Virgin Islands includes Jos Van Dyke, Tortola, Virgin Gorda, Anegada, and the surrounding smaller cays and islands. The targeted population represents about 10.5% of the total population, which currently stands at approximately 31,538 people, half of the population of which are non-natives. This population pyramid of the British Virgin Islands compares the year 2000 to the year 2023, and the importance of studying cardiovascular disease is due to the aging population, and as the population ages, we know there will be an increase in prevalence of CVD. This health problem analysis breaks down the factors that contribute either indirectly or directly to our health problem, which is cardiovascular disease, as well as identifies the modifying and the protective factors that affect cardiovascular disease. The indirect contributing factors include frequency of natural disasters, health policies and access to adequate medical services, and perceptions of health among our targeted population. Direct contributing factors that impact cardiovascular disease include hypertension, diabetes, and obesity. The risk factors for cardiovascular disease that exacerbates the condition include tobacco use and alcohol consumption, and the factors that protect against cardiovascular disease includes proper diet and physical activity. The first indirect contributing factor that I will be discussing is the frequency of natural disasters. In recent years, there has been an increase in the frequency of natural disasters, which presents in high-risk areas that have a high concentration of the population, as well as this increase in the frequency and intensity of extreme weather conditions have arisen because of a rise in global surface temperatures. The natural disasters that impact the British Virgin Islands include hurricanes due to the location of the British Virgin Islands along the Atlantic hurricane belt, which causes floods, and in the dry seasons causes droughts. The impact of frequent natural disasters includes destruction to infrastructure, which includes homes, businesses, and in particularly hospitals and clinics, as well as disruption of economic activity, which includes the loss of income and increase in poverty. These particular impacts indirectly impacts the targeted population in that there is not proper access to hospitals and clinics as a result of these natural disasters, and the loss of income and the increase in poverty affects access to proper medical care as well. The indirect impact of cardiovascular disease, as stated, has been the access to healthcare for non-life-threatening diseases, especially after natural disasters, as the focus on natural disasters is the severe cases. The prevalence of CVD and fatalities caused by CVDs increase, particularly after a hurricane. Access to healthcare is, and the healthcare policy in the British Virgin Islands currently, there indirectly impacts the targeted population in that there are only a few healthcare facilities. The healthcare payments are not adequate, as well as there are limited health services. The healthcare facilities on or within the British Virgin Islands include two hospitals: People's Hospital, which is a public hospital located on Tortola, and Bougainvillea Clinic, which is a private hospital also located on Tortola. There are also 9 community clinics throughout the territory. Healthcare payments also present an issue as it's only limited to out-of-pocket payments by the targeted population and or private health insurance. There is also a limited health services that can be provided, as there are only a few healthcare facilities, and with only a few healthcare facilities, there is not the proper equipment to handle severe cases. And in some of these severe cases, these specialized services has to be outsourced to other islands or mainlands nearby. Another indirect factor that affects the 65 and older community in the British Virgin Islands includes perceptions of health. So how our targeted population perceive proper health care. This will include routine follow-up with their medical providers. So as stated, with the frequency of natural disasters, with lack of access to proper funds for health conditions, there's going to be an inconsistency in routine checkups. And in addition, medication compliance also affects the targeted population, as the issues that are being brought up includes the suboptimal use of medicines and the proper medicines used. The direct contributing risk factors that we are going to be discussing, as previously mentioned, include hypertension, diabetes, and obesity. And the presence of risk factors in general increases the risk of disease. However, with cardiovascular disease specifically, the more risk factors present means that there will be a higher likelihood of the cardiovascular disease. Hypertension, in this study by James et al., we see in this graph that the prevalence or percentage of hypertension increases with the increase in body mass index. And according to the study, almost 46% or a little over 46% were either pre-hypertensive and hypertensive. For diabetes being a risk factor, diabetes was defined as greater than 7 millimoles per liter, or A1C, and the increase in prevalence was associated with overweight or obesity. So as noted in the graph here, the overweight and obese had a significantly higher prevalence as compared to the underweight and normal weight. And lastly, obesity, which we saw impacts the other 2 risk factors. In this particular study by James et al., we noticed that there's 49.2% of the population was overweight, with a BMI that was either greater than 25. High prevalence of physical inactivity or low physical activity associated with the majority of subjects who were obese. This just means that we saw a direct impact of physical inactivity and low physical inactivity affecting the BMI of the studied population. And ultimately, we say this to say that obesity, hypertension, and diabetes together increases the risk factor for cardiovascular disease. The modifying and non-modifying risk factors include non-modifying age. According to James et al., people older than 45 years of age had a higher risk of obtaining cardiovascular disease. Modifying risk factors include alcohol consumption, smoking, poor diet, and physical inactivity. Alcohol consumption and smoking exacerbates the risk for cardiovascular disease, as well as poor diet, which includes processed foods, and physical inactivity, which we saw in the previous slides, along with obesity, diabetes, and hypertension, increases the risk for cardiovascular disease. Protective factors. In my research, I can report that the factors that actually protect against someone in our targeted population having cardiovascular disease includes proper diet and physical inactivity or physical activity. From the research on by James et al., we're able to see that physical inactivity directly linked to the direct risk factors of cardiovascular disease, which directly impacts the prevalence of cardiovascular disease. The best way to reach our targeted population, which is our 65 and older community, includes at religious gatherings and news releases. What I have found in my research is that this particular population, oftentimes on the British Virgin Islands, goes to religious gatherings quite frequently and are able to receive information, especially public health information, at those gatherings. In addition, the 65 and older community are watchers of major news networks, and therefore news releases would be a proper communication method to reach our targeted population. Opportunities for improvement. So what can help in reducing the prevalence or incidence of cardiovascular disease include health promotion, education that targets modifying lifestyle risk factors. Also, increase in health networks, which was shown to impact the physical activities for our targeted population. So the increase in health networks when our targeted population was around a community of people that encouraged proper lifestyle choices, the level of physical activity increased. In addition, access to healthier food options. So as stated, diet is a protective factor for cardiovascular disease. So with access to proper healthier foods, the targeted population can reduce the risk for cardiovascular disease. These are the references that I have researched. Thank you so much for coming. I appreciate your time.